Hi, I'm Emmett Lynskey from National Vascular Physicians. Just by way of brief introduction, I'm an interventional radiologist. I've been in practice for 10 years. The first 8 years of my career, I was at Georgetown University, where I did my fellowship. And I've been here at National Vascular Physicians as Chief Medical Officer and co-founder for the last two. Coming in, relating to what we can offer a primary care site. Really, there are several areas that we like to focus on. The first is looking at patients with vein and vascular issues. At our practice, what we hope to be able to offer is a comprehensive evaluation, not only from the radiological side, being able to perform and read the ultrasounds as needed, but also in terms of treatment. And it's not only treating what is PAD, but also any vascular issues. One of the common things that we see is people with lower extremity swelling and pain. Uh, and you don't necessarily have to have giant varicose veins in order to have chronic venous disease. And I think our typical patient, if I were to think about them, is a 50 plus year old male with chronic lower extremity swelling that's refractory to diuretics. The second area that we really see a lot of patients from the primary care setting is our young African American females who tend to have a lot of pain with their periods, prolonged periods, and are anemic. If you are prescribing iron for anemia and someone with fibroids, we're someone who could evaluate this patient and potentially treat them in a non-surgical way. I think traditionally everyone understands that uterine fibroid embolization is a possibility of treating people with fibroids, but most people don't realize that it is approved and it is actually recommended by the American College of Gynecology. And it's actually performed through a pinhole in the wrist. The recovery is usually 2 to 3 days, and the success rate and satisfaction rate equals that of surgery. And then lastly, either from that the last side of things that we can offer primary care is really just about anything else that an interventional radiologist in the hospital can do. They're just about anything from a biopsy to a port placement to a line placement to just an evaluation. If it's something where you just need to even talk to us to go over imaging, we want to be there for you as not only a partner in treating your patients, but also in a partner in helping you diagnose your patients and maybe interpreting some of the confusing radiology reports you might get from elsewhere.